It's California Edition. I'm Brad Pomerance. You know him. His name is Hector de la Torre. He was a member of the California State Assembly from 2004 to 2010. He is now the executive director of the Transamerica Center for Health Studies. Good to see you, my friend. What is the Transamerica Center for Health Studies?
It's a national nonprofit that focuses on empowering consumers to engage in the health coverage, health insurance marketplace, and also some health and wellness advice that they can't get in other places, or maybe not all in one place.
Right. So obviously you're intricately involved in the rollout of the Affordable Care Act, also known as Obamacare. And I want to get a sense from you about your general view of the rollout. And then I want to talk about specific populations. But what do you think about generally, either California or nationally, about the rollout?
Well, I think nationally, you know, having 8 million people get coverage through the exchanges is a positive. I think the whole point of this exercise was to get people covered, to reduce expenses in other parts of the health marketplace, for example, ER rooms.
Sure.
And so in that sense, for the first year, despite all the difficulties they had with the website, et cetera, they did a decent job. There's a lot more to do in certain areas, in certain parts of the country, and with certain demographics.
What was interesting to me about the rollout is, as I understand it, the experts looked at the 50 states, and they picked 2 states as bright spots. California, not a huge surprise, we signed on early, and Kentucky. That's a surprise. I would not have picked Kentucky as the other bright spot a year ago. Yeah. Do you have a sense as to why California seems to be a bright spot as well as Kentucky?
Well, in both cases, both of those states really pushed to make it a success. In Kentucky, you have a governor who really was aggressive.
A Democratic governor.
But they, regardless of party, they both were very, very supportive of pushing this and saw it as a means of reducing healthcare costs across the board. And so I think that's why they took the time and the effort and the investment to make it happen. You have a state like Oregon, which had a governor who was very aggressive, very supportive of reform, and it didn't go well at all.
That's an understatement.
So you do have, you know, best intentions in that case did not pan out. So you do have those 2 examples because there was a desire and some effectiveness behind it.
Right. Let's talk about California. As I said, it's considered a bright spot. Why?
Well, because
what happened?
It was, I think, one of the positive examples of a holistic approach. Again, the whole point of this exercise was to get people covered by any means. And so you had the component of the exchange, which functioned well. Not fantastic. We had some issues with our website as well, and call center.
But nothing like healthcare.gov.
The call centers were a little oversubscribed, and there were some issues with call waiting. But for the most part, that worked. But there was also a simultaneous push into Medi-Cal, and that got significant numbers of coverage. So the exchange had 1.4 million people sign up, and for private insurance, and the Medi-Cal was 1.2 million, right about the same number.
California is a state that's accepted the expansion. About half the states have accepted the expansion. I want to talk specifically, if I may, about the Latino community, which is particularly important here in California. We have a growing Latino community. I think it's fair to say, sir, that the early numbers looked awful as it related to Latino enrollment, specifically in California. I mean, there was a bona fide panic because if Latinos did not sign up, Cover California was not going to be considered a success. Lo and behold, you know, I don't mean to be Pollyanna, but it seemed like by the end, the Latino numbers really started to come in. What happened?
I think it was 2 things. One, on the front end, there were those issues that we talked about previously. There were some problems with the website, with signups, et cetera, with the call centers. And so on the front end, I think the focus was all on fixing those problems and not on really reaching out to the Latino community and other hard-to-reach communities. And I think there was a shift in resources that took place over the course of all those months. The second is that the Latino community is very young. And the corresponding figure to Latinos signing up late is that young people signed up late. those under 35, which are very much needed for health reform to work, signed up disproportionately in the last month of signups.
I'm also wondering if part of the challenge facing the proponents when they were trying to bring in the Latino community is you had to convince the mujeres. You had to convince the mothers.
Yes.
Was that part of it, that the matriarchs were a little nervous at first, but once you got the mujeres on board, you were in good shape?
I wouldn't call it nervous. I think this is complicated stuff.
Right.
If you've never had insurance,
right,
to all of a sudden think, well, I've got to buy health insurance, and it's going to cost me what, and what do I need to do, and then once I have it, how do I go to a doctor? All of that is very, very complicated, and it required effort, and so that's why you need things like promotoras, and people who are on the phone, who are bilingual, who can take that call from the mother to explain it. Was
there a fear, though, amongst some people in the Latino community that I'm giving my name to the government, even though I'm legal, because you have to be legal, you have to be documented to participate. I don't want my name in any government system.
You've heard those stories, but I think what we know is roughly 30% of the Latino population prefers to get their information in Spanish, for example, and so that's 70% that don't. And so, what were you doing with the 70% to reach out to them, and did you have the resources to address that 30%? And I think that was one of the places where they may have been weaker, is in providing that material both online and with a human being, whether it's face-to-face or on the phone.
Although we may think we are the center of the universe, we are not. There are other states with large Latino populations. Texas, Florida, New York, New Jersey. How did those states do in terms of signing up Latinos who, as we know, had been disproportionately uninsured?
Yes. Well, we did a nationwide survey, an analysis of enrollment figures throughout this process at TCHS.
Right, of course.
And what we found was that Texas and Florida are two states similar to California in terms of Latino populations and in terms of uninsured Latino populations, had about the same percentage of signups, yet they spent almost nothing on outreach in the Latino communities.
So was it Univision and Telemundo was talking to a national audience, and so that worked? Was it our money was poorly spent here in California?
I think most people were getting their information from the news and from media sources, and that did the trick in those places. Whatever was taking place on the ground in terms of face-to-face contact or on the phone communication was happening by nonprofits. It wasn't happening by government.
So obviously Texas, Florida, they're seen as more redder states, a little more hostile to Obamacare, at least on the governmental level. What about states with large Latino communities like New York, New Jersey, Illinois, bluer states, where presumably the government would have been more favorable?
Well, they did okay, but again, the thing that jumps out at you is those two states contrasted with California, because at the end of the day, they ended up pretty much in the same place.
So we're heading into the second year.
Yes.
What is TCHS doing to continue to build the momentum that the Affordable Care Act seems to have maintained?
Well, first of all, I want to make really clear, TCHS is neutral on the Affordable Care Act.
Yeah.
We just try to educate people, and they'll make a choice based on what's best for them. We are looking at business as they engage. The mandate is going to kick in this next year for employers with over 100 employees. A year later, employers with 50 to 99 employees will be in. Employers with under 50 employees will never have to comply. So we are very focused on those groups, particularly the small business group. There are tax breaks available to them. We have a 50-state shop guide that explains to them how they can get insurance for their employees.
You'll come back?
Absolutely.
His name is Hector de la Torre. He is the Executive Director of the Transamerica Center for Health Studies. I'm Brian Pomerance. It's California Edition.